Treatment of acute respiratory distress syndrome is primarily supportive and focuses on treating the underlying cause. Supported treatment includes oxygenation, ventilation management, hemodynamic management, and nutrition. The goals are to 1. Reduce hypoxia, 2. Improve acidosis, 3. Improve or maintain cardiac function, 4. Treat the underlying cause, and 5. Avoid complications. Optimum fluid management in patients with acute respiratory distress syndrome is centered on conservative fluid administration in order to limit lung edema while also preventing overdiuresis, hypotension, and renal failure. If acute respiratory distress syndrome is induced by severe sepsis or septic shock, goal-directed therapy using the administration of crystalloid blood and vasoactive and inotropic agents should be followed for the first 6 to 8 hours. To promote healing and prevent complications in patients who are seriously ill, adequate nutrition, either internally or paternally, is essential. If the patient can tolerate internal feedings, this is the preferred route. Recent literature suggests that internal nutrition is associated with fewer intravascular infections, less GI bleeding, and a decrease in bacterial translocation. There are no proven preferred internal feeding formulas for the patient who has acute respiratory distress syndrome, and there is no benefit to overfeeding. Therefore, it's important to consult a nutritionist to calculate calorie goals for the patient and prevent overfeeding. Life-threatening hypoxia from respiratory failure is treated with intubation and institution of mechanical ventilation. Most patients who develop acute respiratory distress syndrome cannot be treated with supplemental oxygen alone. Therefore, mechanical ventilation should be initiated when saturations cannot be maintained at 90% with supplemental oxygen. Mechanical ventilation should be instituted early to prevent aspiration and reduce the patient's work of breathing, allowing the underlying initiating event to be treated and the lung to begin to heal.